talk a little bit about the operations that she had performed on her, and because of her issues with her hand and skin cancer. And I just want to introduce you to Jeannie.
Hello.
So Jeannie, could you tell us how you and I met?
From a nurse in the parking garage. She had a cast on her hand, and I was like, oh my goodness, would you break your hand? And she said, no, I had hand surgery. And I said, I need a hand surgeon. My thumbs are killing me. And she goes, that's exactly what Dr. Bidic did for me. And so she gave me his name, and I called about a month later, and I came in. And
So what was the hand problem you were having?
both of my thumbs hurt a lot. I had no grip strength. I not only could I not pick things up, but I couldn't keep things in my hand. I dropped things all the time, and this had been going on probably for 4 or 5 years.
Did you have injections in your hand?
I tried to get injections by our physical medicine doctors who do that, and they couldn't get the needle in because my joints were like fused together because there was no more cartilage.
Did you have night waking before on this?
Oh, my hands went to sleep, and my thumbs would hurt. And if I turned over the wrong way or put my hand under the pillow at night and got my thumb in a not very good position, it'd wake me up because it hurt.
Can you show the camera where on your finger it is, or the thumb it was?
Yeah, and you really can't see it. Dr. Bidic took this whole CMC joint out. I believe that's the correct term.
That's correct.
And I also had carpal tunnel, and I had a trigger finger, and he moved some ligaments, I think, around, and I had 3 pins, I think, with a cast onto here that he anchored to these bones for 6 weeks.
So how was your recovery after the operation?
My recovery after the operation was great. And after that, I had Carol Hall, our hand therapist, and PM&R do therapy for 3.5 months on either hand, and here I am.
Yeah, I need to stress the importance of having a fantastic therapist, and I only work with therapists that are certified hand therapists, which means they've had not only the occupational therapist, but they've gone through a special amount of hours in training and testing so that they know what they're doing with a very complex instrument, which is the hand. So now it's functioning well?
Oh, it's great.
And is there any limitations to what you can do now?
No. I can't pick up real heavy things, but as far as picking things up, gripping things, doing normal things every day, I'm fine.
Would you do it again?
I'll do it in a minute. If I can find him when he leaves, I'll do it in a minute.